So prostate cancer is a major public health problem. It's the most common cancer in men. You want to have early diagnosis, and that often starts with just a PSA blood test that most patients get from either their primary care physician or a urologist. And depending on what those levels are and the physical exam, there may need to be a prostate biopsy. So that's usually the first step to getting this problem taken care of. Men can have increased urinary symptoms, such as urinating more frequently, getting up often at night, having a sensation that they're not completely emptying their bladder. Those are usually just associated with a benign enlarged prostate, but that's often a trigger to go see a urologist and get that PSA checked. If the PSA level starts to increase over time, year after year, again, that's really when we want to do a biopsy. But at Good Samaritan, we're looking forward to starting a new technique called MRI-guided biopsy, where we image the prostate using a large magnet. Often we can identify small areas that look abnormal on the MRI and then direct the needles directly to those areas. And that's actually been shown to be very helpful in finding some of the more serious forms of prostate cancer. While we don't, because not all prostate cancers need to be treated. Prostate cancer typically affects men over 50. A lot of organizations like the American Cancer Society suggest talking to their doctor about getting that PSA blood test. That test has been shown to reduce the risk of dying from prostate cancer by about 20%. So thanks to early diagnosis, we can really successfully take care of this condition. And we may do the biopsy, and your urologist may tell the patient that this is a very slow-growing tumor on a microscope. There's only a small area, and the PSA is advancing at a very slow pace. So many of those patients can actually be carefully watched under the expert care of a urologist. One of the biggest advantages of Good Samaritan and Catholic Health Services of Long Island as a whole is that we really work as a cohesive team. Whether you have stage 1 or stage 2 prostate cancer, the 5-year survival from that prostate cancer is 100%. People do not die of prostate cancer within a 5-year. It's actually very unlikely to die within a 10-year period. So you really want to work with your urologist as well as someone like a radiation oncologist, which is what I do, on determining, do you even need to treat this? So I think that's the first step. At Good Samaritan, we offer active surveillance. People don't like the notion of what we call watchful waiting, that I'm just going to pretend this didn't happen. But we do something called active surveillance, where even though we're not going to recommend treatment immediately, you're going to be monitored very closely with the urologist with physical exams, PSA blood tests a couple times a year. And sometimes we even need to repeat the biopsy just to make sure that the situation hasn't gotten worse. We want to stop it in its tracks right now. Then we will talk about different treatment options, and they include surgery. Something that, and we're lucky at Good Samaritan have a very talented robotic surgeon named Dr. Christopher Tala, who is very skilled with the Da Vinci robot. Prostate surgery does have some risks. You're removing the prostate. You can live without a prostate, but the prostate still does have a function, both in terms of urinating and also sexual function. For the patients who don't want surgery, then radiation is an excellent non-surgical approach that's actually been shown to have rates of cure as high as surgery. So even though for early stage prostate cancer, this is mainly the domain of the urologist and the radiation oncologist and even the primary care physician. For patients with more serious forms of prostate cancer, and these might be very fast-growing prostate cancers, tumors at a very high PSA level, or tumors that have actually spread beyond the prostate. At that point, it's important to include the medical oncologist. We're right here today at the Cancer Institute at Good Samaritan. We have an amazing team of 7 medical oncologists who partner with us on giving medical therapy. It's actually been a renaissance of drug development for prostate cancer in the last 5 to 10 years. And so it's not just hormone shots anymore. We're well past that. They've developed different types of pills, intravenous treatments, immunotherapies, really different drugs that have been shown to help patients with more advanced forms of prostate cancer. But obviously, our goal as a radiation oncology and urology communities is to prevent patients from getting to that more advanced stage, and making an early diagnosis and giving effective treatment for patients with early stage prostate cancer. One thing we're very excited about at Good Samaritan is we've actually developed a new way to give completely non-invasive treatment for prostate cancer. So in 2019, we installed a new state-of-the-art radiation equipment called the Varian Edge. And we were one of the first, I think we were the second program on Long Island with this technology. So we actually have the best level technology on Long Island. And we wanted to develop a way to completely non-invasively treat these prostate cancers with very high success rates. But what we've done at Good Samaritan is we wanted to develop a non-invasive approach that uses that MRI technology, again, using a magnet to image the prostate with no radiation exposure. And it turns out that we could often see tumors inside the prostate, and then we could deliver that treatment because we found that about 70% of patients that we treated actually have calcifications in the prostate that we could image every day. And this allows us to accurately target the prostate while avoiding the rectum and bladder. And we recently submitted our results for publication. It's going to be published in the British Journal of Radiology. It's not published yet, but that we had 96% success at controlling the PSA in men with prostate cancer. By the way, of all different stages. It includes stage 1, but also included stage 3. And with very low rates of rectal toxicity and urinary toxicity. So, we feel, we're very happy to share this with the medical community and, really bring that state-of-the-art therapy to our patients. So the last thing patients often want to do is to undergo a second invasive procedure. And what we showed is that, perhaps we don't need to do that second procedure. And that's, again, state-of-the-art treatment that's at this point only available at Good Samaritan.